So one of my friends asked me, how do you know if you have rheumatoid arthritis? Well, when it comes to see a rheumatologist, we usually ask you questions about your history. How long have you had joint pain? Where is the joint pain? In the small joints of your hands, in your back, in your knees, in your ankles? Do you see inflammation or swelling in your joints? And one very important question is, how long is the stiffness in the morning? If you have regular arthritis, osteoarthritis, that pain gets worse throughout the day and you're stiff for about 5 minutes in the morning. But when you have rheumatoid arthritis or inflammatory types of arthritis, that stiffness lasts about an hour, sometimes 2 hours or more in the morning. So that's a very important thing that we ask patients. Then we examine patients. We actually touch every little joint and we examine for swelling and tenderness, and we count them even for a joint count. So we examine your joints, your everywhere joints. We also check for the lungs, the heart, the eyes, for systemic signs of an inflammatory disease. Then we check labs, rheumatoid factor, a CCP antibody, a MCV antibody. We check your inflammatory markers in the blood to see if it also detects inflammation. Then we check your x-rays or sometimes an ultrasound, and even if those are negative, we check sometimes an MRI to see very subtle inflammation. With all those things combined, a rheumatologist can determine if you have rheumatoid arthritis. The interesting thing is that sometimes you have antibodies for rheumatoid arthritis and you don't have the disease yet. Those antibodies, those proteins, can be positive up to 20 years before you develop a disease. And vice versa, sometimes you don't have the antibodies, but you have swelling and inflammation. So we keep digging to try to see what kind of inflammatory arthritis you have. My name is Dr. Jane Ayala. I'm a board-certified rheumatologist. Please ask more questions in the comments and visit our website, rheumatoid.com, to learn more.